Hi, I'm Dr. Ginger Garner. I'm back with you again to help you preserve and have happy hips your whole life. Injury prevention is a big deal for me, and it's something that doesn't often get addressed. I don't often see you and people in general for injury prevention in physical therapy, and I wish I did because I think our healthcare in general would be a lot better if we could do that. So, in lieu of that, I'd like to show you two poses that are often done incorrectly and unknowingly in yoga classes and in yoga therapy in general. I would like to show you how to do those more safely, more effectively for better strength, better power, which means strength plus endurance in yoga class. It's the proverbial work smarter, not harder, essentially. Those two poses that we want to work on are Warrior 1 and Warrior 2. I'm going to show you what not to do in class first, and then I'm going to show you how to correct it. Okay? Oftentimes in class, you may be asked to come into Warrior 1 in a variety of ways. Maybe it's jumping, maybe it's stepping forward. I would like for you to avoid, particularly if you have hip, pelvic, or back pain at all, which includes the sacroiliac joint, I'd like you to avoid stepping forward or jumping into Warrior 1, and instead I'd like for you to do it this way. It's to come into mountain first at the front of your mat. Feel what that very tall posture would be like, and I don't want to tell you exactly any hard and fast kind of cookbook rules on how to stand in mountain because it's different for every hip joint and set of hip joints. So I want you to find your mountain that feels comfortable to you. I'd like for you to transfer down into chair, so Utkatasana, from a tall mountain into chair. And for people that I work with in therapy, I often have them bring their hands here, so they can feel that power breath. If you need to feel that power breath, watch my power breath video, TATD power breath video. Google it, it comes up easily. You can also find it on Dr. Ginger Garner on Facebook or my website, medicaltherapeuticyoga.com, or on the YogaMate website under power breath. Have your hands here. If you need to, hiss down into chair. Take a small step back with Warrior 1. And this is where the first mistake is usually made. Warrior 1 is way back here, causing a lot of extension in the back and a lot of maximum extension in the hip. If you have hip pain, hip labral injury, impingement, this won't work. This is going to make your pain worse, most likely. And we don't want that. We want happy hips. This is what I'd like for you to do instead of that long lunge back. Is mountain. If you need to hiss through power breaths, feel that neutral spine happening, which is not a back bend and not a rounded spine, somewhere in between. Short lunge back. Do you see how short my lunge is? Not very big. It's big enough to allow my toes to essentially point forward and not have the foot turn out, because that actually puts a lot of torque on the hip and the SI joint. We're avoiding that for the purposes of hip preservation. Stay out of a back bend here. If you have any hip pain, labral tear issues, arthritis type issues, it's often hard to get full extension in the hip. That's totally fine. If I was seeing you as a physiotherapist, a physical therapist, I would work with you on that to increase that mobility. But in the meantime, what you can do to protect the hip in class is bend that back knee so there is little or maybe even no hip extension in your Warrior 1. And this is the way your Warrior 1 can look. Not so concerned with what the hands will do, but if you do decide to bring your arms above your head, there should be no pain. This is where your Warrior 1 will be. And there are more details I can share and more things that I would do with you to be able to get that power and placement of the hip in an optimal position for rehabilitation if you did have hip pain. That's your entry and exit into Warrior 1. Pose number 2. Warrior 2. This one is an even bigger offender so far as exacerbating pain, making your hip pain worse, especially if you have a labral tear or impingement or arthritis, or if you've had a hip replacement. This is the way I would like for you to do Warrior II. Here we go. First, what to avoid. Avoid jumping into Warrior II. Avoid stepping forward into Warrior II. That puts a lot of shear force on the knee joint. Let's be kind to our joints. We want them to last as long as possible, especially if they've been replaced. This is the way I'd like for you to do Warrior II. Mountain, power breath, hiss if you need to, through that power breath. Slowly lunge back into a Warrior II position. This is where Warrior II usually goes awry. Warrior II can often look like this. Seems fine from the outset, but if you have hip pain, it's going to make it likely worse, or increase the risk that it could worsen your hip pain or do more damage. Everyone has different shape of the hip socket as well as the femur and the neck of the femur and the shaft of the femur and the upper thigh bone. This means Warrior II needs to be recalibrated biomechanically. Instead of just popping down into a typical Warrior II with the toe pointing forward and the back toe pointing in, and see how the spine just kind of dumps forward? I call this dumping the pelvis. We want to do this instead. Point your toes forward. Look down. No hip pain. If you have hip pain already here, stop. Don't do Warrior II. This needs to be evaluated by a physical therapist before you go any further. If you don't have hip pain here, I want you to bend the knees, come down into a forward fold, a wide angle forward standing bend. But we're not going to go all the way down into it, particularly if you don't have enough mobility in the back side of the body. And with those of you with hip pain, often the hamstrings are involved, the glute medius is involved, and we don't want to aggravate any of that. So we're just going to come to here. Okay? Let's pretend that we're in a wide angle forward standing bend. Now, I want you to turn your front foot out only as far as it can go with no hip pain. Leave your back foot either straight forward or turn slightly in. Find a spinal neutral, which means I'm not slouching. Find a spinal neutral where the shoulders are broad and you're not back bending or swaying, okay, or flattening the back. From this point, you see how my pelvis is neutral. It's in a happy position. Stand upright. Do you notice how my front foot is not all the way out? That's because I've recalibrated the pose based on what my hip is capable of doing. Your foot will be in a different position. But the baseline is, if you have hip pain, a hip replacement, or you know you have some other hip intra-articular inside the joint issue, please bend both knees. Bend both knees and keep the pelvis upright. Otherwise, try straightening the back knee. Again, if you have hip pain, go back to bent knee. You can try straightening the back knee, but don't let the pelvis dump. Keep it upright. Now look at your front foot. Your knee and your foot should be in the same alignment. That means I don't want my knee collapsed or my knee moving way backwards past my foot. Keep the knee right over the foot. This is my Warrior II for today. Pain-free. It's much more difficult to hold this pose than it is just to dump into the traditional, I won't say traditional, but a typical type of Warrior II. It takes less power, which means less strength, less endurance, less control, less coordination, less proprioception, less of all the septions, to do a Warrior II like you typically see it. It takes a lot more power and control, athleticism and ability and patience to be able to do it this way. So as you drop down into your new Warrior II, and the knee is over the foot does not have to be straight out. It is wherever it is comfortable to allow the spine to have priority, not the extremities here. We want stability close in first, that's called proximal stability, so that we can have distal mobility and happy movement. If you want to, you can add the arms from here. I call this an arm spiral. This is also a free video on medicaltherapeuticyoga.com. With your free registration, you get access to dozens of videos that I have for free for you. Arm spiral is one of them, so I won't instruct that now. Just go to the video to see that. And then you drop down into a warrior two that you have recalibrated, where the spine gets priority, the extremities are being strengthened, you're working on endurance, and you also have a safe and happy hip. Thanks for joining me. And sweep back up into mountain. Hopefully these two practices will make your warrior one and your warrior two a lot more safe, a lot more effective, and prevent any injury that you might have, as well as improve athleticism and your ability to just enjoy life based on having a functional, happy, strong hip. Thanks.